Hello everyone, today we are going to discuss about scars and various types of scars. So in this diagram you can see that this is a picture which is taken directly from the Valiant Love 28th edition book. So this is a patient of multiple keloid scars. Okay, so we must have to discuss what is scar and what are the various types of scars. So see here everyone, the scars are formed due to the it is a form due to the result of your remodeling or maturation phase. So the remodeling or the maturation phase of the wound healing results in scar formation. Okay, so after that there will be formation of the scar. First thing what you must have to remember, first there will be formation of an immature scar. Okay, so immature scar is pinkish in color. It is hard, slightly raised, and often itchy also. Okay, but when it is going to become the mature scar, okay, so as the collagen mature, the scars becomes acellular. Okay, so it becomes acellular as fibroblast and blood vessels reduce. Okay, blood vessels reduce, so it results in a formation of mature scar. So what will be the external features of the mature scar? It will be pale, scar becomes slightly softer, it becomes flat, and itchiness this one, it becomes or it disappears. Okay, itchiness disappears. So it will be the characteristics of the mature scar. Okay, next point which you must have to remember, it changes over a period of first 3 months, but it will continue to mature over period of 1 to 2 years. Okay, and two important MCQs which you must have to remember: maximum tensile strength will reach in 12 weeks or 3 months post injury. One MCQ. Second MCQ, maximum tensile strength will continue to increase but will never exceed or around 80% of your normal skin. So these two are the MCQs which you must have to remember. Okay, so this is your MCQ, this is also your MCQ. How you are going to manage these scars? So you can go for pressure or compression therapy. You can go for silicone sheets and gels. You can go for intralesional corticosteroid injection, and the name of the injection is triamcinolone. This is also your MCQ which you must have to remember. Okay, and if it still proceeds, then you can go for the surgery. Okay, so please remember that prolonged inflammation can also lead to excessive scar formation. Okay, so there are three types of scars which you must have to remember. Three types of scar. It can be atrophic, it can be hypertrophic, and it can be keloid scar. The first picture which I showed you was that a picture of a keloid scar. So what are the characteristics of atrophic scar? It is usually pale, flat, and stretched in appearance. Most commonly it is seen in the back area. Okay, so this is the characteristics of your atrophic scar. Okay, so now we must have to know what is a hypertrophic scar and a keloid scar. So see this diagram, all students. Okay, so this is an example of a keloid scar. So this is your hypertrophic scar. Okay, this question was asked many times in your FMG examination. So how you are going to differentiate between these two scars? So we are going to write the difference between a hypertrophic scar and a keloid scar. So what are the difference? Number one, in hypertrophic scar there is excess collagen deposition in parallel pattern. And which collagen mainly? It is your type 3 collagen. In the keloid scar, it is excess collagen is uh, deposited in disorganized pattern, and it contains both type 1 and type 3 collagen fibers. Okay, second point, hypertrophic scar do not extend beyond the boundary of original incision or the wound. Okay, but this keloid scar, it will extends beyond the boundary of original incision and wound. So see this picture, it is not growing beyond the boundary. So this is your hypertrophy. So it is growing beyond the boundaries, so it is your keloid scar. So if the scar is growing, you can say extending beyond the boundaries of original incision or wound, this is your keloid scar. But if it remains within the boundaries of an incision or the wound, this is your hypertrophic scar. Okay, next important difference, hypertrophic scar will eventually regress with time. It will regress with time. Keloid is not going to regress with time. And difficult to treat. Okay. Hypertrophic scar most commonly seen in the areas of tension or wounds crossing the tension lines. Okay, wound crossing the tension lines, that is your Langer lines. Okay, here the etiology in the keloid scar, etiology is unknown. It is unknown etiology. Okay, it's unknown etiology. It is most commonly seen in the children. Hypertrophic scar, it is most commonly seen in people with darker skin pigmentation or black people. Okay, and in the age of 10 to 30 years. Okay, it is mostly seen in the flexor surface. Keloid scar, please remember, it is most commonly seen in the sternum. This question was asked in your FMG examination. Keloid scar most commonly seen where? Answer was the sternum. Okay, so how you are going to manage these scars now? So see here, in hypertrophic scar management, first management is pressure therapy, followed by silicone gel sheet. Then you can go for intralesional steroid injection also. Intralesional steroid, answer is triamcinolone. This is also your MCQ. If it persists for more than an year, if it persists for an year, then you can go for what? Surgical excision plus primary closure of the wound. Okay, so this is the management of hypertrophic scar. What is the management of your keloid scar? First line is again your silicone gel sheets plus pressure therapy plus intralesional steroid injection into the scar. That is again your triamcinolone. If no improvement, for example, if it, because it's very difficult to treat, it cannot regress with time. So if no improvement for an year, you can go for excision, radiotherapy, or brachytherapy. Brachytherapy, you give the radiation near to that scar. Okay, so this is your topic of hypertrophic scar, keloid scar, what is scar, how you are going to manage it. I hope it is clear to all of you. Thank you.